Hello, everybody. Welcome to our third episode of Public Health One-on-One. And today we have Siddhesh with us. Siddhesh is a public health researcher. He's currently working as a researcher in Duke University in North Carolina. And he's also the co-founder of Association for Socially Applicable Research. And he is a fellow in the Lancet Commission. And that's how I actually got to know him, through the Lancet Commission. Thanks a lot, Siddhesh, for joining us today. I know you're extremely busy, but thanks for taking out time.
Of course, yeah. More than happy to be here.
And today, the agenda of this talk is that we are going to discuss the National Suicide Prevention Strategy, which recently came out. And before we sort of get into the entire report and sort of see what it is about and how good or bad it is, what do you think is how big is the problem of suicide in India?
Yeah. No, that's a really I think that's an interesting question, and different, like, depending on whom you ask, the answer is going to be very different, right? So my focus, even within public health, has been split across a couple of different domains, and an important domain has been mental health. So the way I look at suicide, it comes from more of a mental health background. Now, that's not true for a lot of different researchers and for a lot of different, like, domains or disciplines. So suicide traditionally and historically, even within public health, has been considered for a long time a part of injury, right?
Yeah.
And so it has been kind of not associated with mental health as much as it should have been.
Hmm.
So coming to the question of India, I think uh, like, one thing to know for sure is that, given our population size, in terms of absolute numbers, we are a major hotspot for suicide in the entire world. So that's like the I think that's like first takeaway. Uh, the second important thing to know would be that it's not just in terms of absolute numbers, but uh, for a low and middle income country, so, like, based on, like, the World Bank's classification, India falls under middle income country right now. So for a low middle income country, we still have actually a much higher rate of suicide, and a lot of that is being driven in India's case by a younger demographic, which is a worrying sign, right? Uh, Third important thing with regards to suicide as a problem is that uh, we we typically just go by number of deaths, or like mortality numbers and those things, right?
Hmm.
And if, let's say, so for instance, like, in case of India, if we say that uh like yeah like annually, on an average, we lose about uh 8 lakh people to suicide. That sounds like a very small number in a
Hmm.
population of over 100 crore people, right? But there are two ways of looking at it. Number one, that suicide globally is still among the top 10 reasons of death, right? So, like, when you look at individual causes, or yeah, individual, like, causes of death, uh like, as a number it might look small, but it's still, as a singular cause, is much higher, right? So that's important to know. And second, we often talk about suicide just as the final step of someone committing suicide and dying by suicide. However, that's a very final stage, and that's a very extreme step that a person reaches to. Uh, we have a lot of research and evidence showing that uh, typically people do not actually die by suicide in their first attempt. So a person who has who has committed suicide has probably thought about it a lot, and has probably attempted it at least a couple of times before. And a lot of that behavior falls under what we refer to as self harm behavior, right? So I feel like there is a lot of focus in India on suicide deaths, but not enough focus on suicidality, which basically represents a kind of self harm behavior or suicidal ideation. So when we are talking about suicide as a problem, from mental health perspective, I would consider ideation, I would consider suicidality, all of those things as part of the larger suicide problem, and not just deaths.
So definitely, like you said, it was considered as an injury, but a lot has happened before this report actually came out. The National Suicide Prevention Strategy. In 2014, we had the National Mental Health Policy. Then, Mental Health Care Act came in 2017, and which actually decriminalized suicide. So till now, we were sort of lodging it as a police complaint. When even we still do that. Actually, the line is still not very clear. So having worked in emergency, I have seen a lot of deliberate self harms, and we would still file a police case report. So coming to that, now that we have sort of decriminalized suicide, how reliable is the data of, like you said, we are still not looking at attempts, suicide attempts. We are still looking at people who actually die because of suicide. And now when it's not a criminal offense, so it's not getting reported like it used to get reported before. So how reliable is the data now?
Yeah, that's a really good question. So I think like I kind of agree with you. So like decriminalizing suicide was an important initiative that Mental Health Care Act of 2017 introduced. That said, yeah, you rightly pointed out that we are still collecting data on suicide uh, in like a like police and like law enforcement system, which means that it is being reported in like the district and like state and national level crime statistics, right?
Yeah.
I think with regards to data collection and reporting, decriminalizing suicide probably has not had an impact yet. What has changed is that you can no longer punish someone for reporting that.
Okay.
So, which means that NCRB statistics are still, at least in like till 2022, are still reliable,
Okay.
as reliable as they have been earlier, and like that is like a whole another topic of discussion and questioning,
Yeah. So how
right?
reliable was it earlier?
Right. So with regards to NCRB statistics, I think there is some evidence based on the National Mental Health Survey that was conducted, and based on some of the modeling exercises that are conducted by WHO as well as the Institute for Health Metrics and Evaluation, IHME. So IHME is the organization which also
The
conducts the
GBD
global burden
study.
of
Yeah.
diseases. Yeah, GBD study. So under that, I think we have some evidence to believe that NCRB statistics are underreported. Uh, Now, what that means is not that there are lapses in data like collection or compilation per se, but suicide as a problem is still a taboo and not discussed, which means that in some cases there is not a proper procedure to actually report some of these deaths or to investigate them. So for instance, for instance, you'll see that even earlier, NCRB reports actually focus separately on major, like bigger cities, metropolitan cities. And so that's kind of a hint towards where their data is coming from, right?
Yeah.
So between, if I were just to guess, even as a layperson, between suicides being reported under the whole NCRB system in Mumbai versus 300 kilometers from Mumbai in a small village, I'm going to guess that a lot of those like reported numbers are coming from Mumbai.
Yeah.
So I think it's it's not about NCRB particularly, but it's about challenges faced by any data collection system in our country,
Yeah.
right? Specifically, data that has some stigma associated with it, right?
Yeah.
Excuse me. So there has been enough evidence that due to all sorts of different reasons, uh, suicide data is underreported in NCRB. That underreporting, it's important to kind of like know that that underreporting also varies from state to state, which basically also tells us that this is a decentralized system, which means that quality of data coming from certain places and certain states is actually much different than that coming from other places.
Yeah.
So, right? Even so, people have done, like these exercises where they'll compare the mortality rates from, let's say, GBD versus mortality rates from NCRB, and they'll calculate like the factor of underreporting. And those factors, we know, like kind of like vary across states, and they go from like a factor of 1 or 1 point something, which is basically almost no underreporting, right? To something as high as 10, which means that in some places, suicide mortality in NCRB is 10 times less reported than some of the other estimates, which we consider reliable.
So coming back to this preventive strategy, this was needed for a long time, and I feel this is like a stepping stone for a national program for suicide prevention. Coming to its aim, it says the aim is to reduce suicide mortality by 10% by 2030, which is in the coming 8 years. And they are still focusing on suicide mortality. It's still not suicide attempt. So what do you think? Why is this aim sort of set at mortality still?
Yeah, I think there are like a couple of things going on there. So first of all, I think like I said, when it comes to suicide, focus traditionally has always been mortality, because that's like the severe thing that everyone wants to look at, right? Uh, in case of like National Suicide Prevention Strategy for India, although it got released in 2022, I know that like the work for it had been going on for a while. So that's why like a lot of statistics that the report cites are from 2020. The report also has like a section which almost looks like an appendix, right? But it also has like a section on specific suicide prevention strategies and like steps uh, during COVID-19 pandemic. I mean, like when we are talking about it in Jan 2023, uh, although we are still like it's debatable whether we are in a pandemic or not.
Yeah.
But the report was under works, right?
Yeah.
So
Yeah.
the target is ki 10% mortality reduction compared to 2020. So we
Okay.
are anyway 2 years into that, right?
Yeah.
So I think an important thing to understand and realize here is ki, like the clock has started ticking way before
Before
any
the
of this
report came
started,
out
right?
also.
Yeah. So I think that's definitely there, and it also has consequences, by the way. So for instance, we'll probably dive into that a little bit later. But the report actually, like the strategy actually does this very amazing thing where it has created immediate, intermediate, and long-term goals, right?
Yeah. Yeah.
And then the long-term targets or goals have like a time period of 8 to 10 years, which means that those are the things that you probably want to do in around 2028, 2030, right?
Yeah.
Then intermediate are like about 5 to 7 years, and short-term goals are supposed to be 2 to 3 years. So we are actually very close to finishing our short-term or immediate goals wala period, right?
Yeah.
So I think with regards to mortality reduction, I think part of the reason why it's focused just on mortality is because that's how we have been looking at suicide for a long time. But then another part is also that suicide mortality is something that's also part of other bigger frameworks, right? So for instance, suicide mortality is something that is one of the indicators under sustainable development goals, and specifically health and well-being, which is like SDG 3, right? So I think a lot of times what happens is that the governments want to create strategies, want to create policies and plans which are tied well to kind of like intergovernmental and like these bigger multinational goals, because that's easier to generate some mobilization, right? So I think those are kind of, and then as the strategy itself mentions, there's also the element key. The WHO Southeast Asia Regional Office recently came up with like its own commitment towards suicide prevention. So our national plan actually comes as kind of a specific commitment in case of India following that.
Okay.
So I think a lot of what is written in the strategy is it's kind of like trying to do two things. First, it's trying to kind of like be in agreement with all of those regional and multinational and international goals, right? So it's trying to do that, and at the same time, then it's also trying to locally contextualize a lot of that in case of India.
Yeah.
So I think that's why there's kind of like a balance of uh, almost like how much can we really do and how much do others agree
Want
with
us to
us
do. Yeah.
about doing something about this, right?
Yeah. Yeah.
So that said, yeah, I mean, like I said, like a really progressive strategy should have also included uh, self-harm associated behavior, suicidality, and some of those things in as its main targets. uh, One good thing though, like about this strategy, is that uh, in its like list of specific indicators under like the main goals, there are indicators that are closely associated with trying to reduce suicide attempts,
Yeah.
right? So although it's not like kind of like that up as like a highlight, it's still there in the strategy, so it's still included, it's not being excluded. But yeah, I mean, a really progressive strategy could have put that at the very top as well.
Yeah. No, definitely. Now coming to I went through the report and I feel it's very detailed, but again I felt some details were missing. They could have done better. I feel coming to the vulnerable groups, they
Mhm.
have mentioned an age group 18 to 45. They have said all transgenders of all age groups are part of the vulnerable group. They have mentioned gender, education status, but I still feel they have not talked about a lot of other things. For example, caste related vulnerable groups, backward class, vulnerable groups. In that sense, they haven't really talked about in this report. Anything you feel they have missed out in this definition of vulnerable groups?
So I think, so well, like to answer that, I think we should clarify how the report is structured, right? So initial part of the report is focused a lot more on data and statistics. uh, and except maybe for global statistics, everything else related to India is taken from NCRB,
Yeah.
right? So then a lot of what is included as data is dependent on what data is being collected in NCRB. Now, NCRB, I think if you look at their kind of like granular data, so which is not available publicly, which is like person level data, right?
Yeah.
In their granular data, I believe they do have data on people's caste, religion, and a lot of other socio-demographic variables. Okay. Uh, I'm not exactly aware of the reason, but they stopped releasing those summaries a while back. So there is a particular year, I believe it's 2014-15, but that's the year where NCRB released data by caste groups as well, like suicide data by caste groups and religious groups.
Okay.
They haven't done it after that year. So I think the reason this group does not mention, like clearly mention, like caste or religions or some of the other important variables, uh, is because they do not have like access to that data right now.
Yeah.
I think that's part of it. The second part of the report is then focused on the strategy itself, right? Like what's the strategy about? What are the goals? What are the specific objectives within goals? And so on. So rather than saying what it's missing, I think it covers a lot. So for instance,
Yeah.
although it doesn't say caste per se, it still says it understands suicide as a multifactorial problem, including specific cultural issues of India, right?
Yeah.
So caste is something that you can easily put under a cultural issue, right?
Yeah.
Or a cultural determinant. So, so so rather than what it's missing, I think the way it's structured, one thing that I realized while reading and rereading uh, the strategy document is that the data actually clearly tells you where some of the efforts need to be focused urgently and where some of the efforts need to be focused more heavily, right?
Hmm.
So there are very specific groups which definitely need intervention, right? There are clearly regions, so like states
Hmm.
or cities that are definitely facing a higher burden of this crisis than other places. That's
Yeah.
not to say ki we shouldn't focus on other thing like
Hmm.
other groups, but there are clearly, like, if you start ranking them, there are clearly cities that will have higher like
Hmm.
rank, or there are clearly groups that will have higher rank, right? So I think a lot of what then goes into the second part, like the strategy part, seems to be very generic and broad,
Yeah.
right?
Yeah.
So, like,
Before we head into that,
yeah,
there was something I want to point out was they have said all transgender age groups are part of the vulnerable group. But
yeah,
if you actually look at the figure,
yeah,
which is the pie chart they have given, they have marked transgender suicides as 0%. But which is actually not true. It's just that they have rounded off the number to whole figures and it's come at zero. But
yeah,
personally, what I personally feel is, again, like you mentioned, stigma is an issue. And then transgender people itself being stigmatized. Suicide of a transgender is very unlikely to get reported. And I feel that this report sort of solidifies that issue by making this look as 0%, by rounding it
yeah,
off and making it very look very insignificant. So what do you think about that?
yeah. No, I think you're right. And again, I think that's that's again a data level issue that's present in NCRB as well, right? Like you said.
Hmm.
So first of all, uh, we do not have a very good sex and gender census in this country, and that's a very new idea anyway, right?
Hmm.
So for instance, I think, if I'm not wrong, this was the first time that in US census they actually asked people to report not just the biological sex but also their preferred gender, right?
Hmm.
So now that's something that India does not do yet, right? So to begin with, we do not know what's the population base there. Now,
Hmm.
to compound onto that problem, like you said, there is stigma associated uh, with the transgender community. Like the larger society is not yet at a place, sadly, that they will accept that community as a part of their own, right?
Hmm. Yeah.
So there is stigma associated with the community. There is also stigma associated with suicide as an issue,
Hmm.
right?
Yeah.
So now this is kind of like actually a really vulnerable group which is being stigmatized for their existence, which basically then also adds on to the stigma of anything related to self harm or suicide behavior,
Hmm.
right? So I think trying to like round the numbers is not a great idea to begin with. I do not think I think we have to be a little bit more careful, and we have to be a little bit more conscientious as to how we are talking about these things, how we are looking at these things, right? So for instance, kind of like, very, जैसे we say in Hindi कि मोटा मोटी, it might look like very progressive कि
Hmm.
in our suicide data we look at male, female and transgender.
Yeah.
But if we start questioning that a little bit, if we start probing that a little bit, ठीक है, it starts creating problems like these, right? Like you said, कि
Yeah.
if you create a pie chart, it's going to look almost 0%, because to begin with the population is small, the reporting is not that great, right?
Hmm.
So a better way to do that is actually to have a separate section to talk about this as an important issue,
Yeah.
right? To specify numbers there, to actually say what are the limitations of these numbers, why this number could be higher,
Hmm.
right? So this is clearly, I mean, even if let's say it's like 0.005 or like 6 or whatever percent,
Hmm.
that's still very clearly an underestimate.
And it should be a trend over the years. Look, if that sort of gives you an idea of how suicide is a problem in that community. If you look at it, 2018, mein how many transgender suicides were reported, and now what's so that's something I was actually expecting, but that 0% is actually very surprising for me.
Yeah. I think
And
another way to actually in all of this, and which might be a little bit more technical than what our discussion is focused on, but I think with regards to a lot of these things, the way we do the way we go about doing numbers, and specifically in case of like suicide data and suicide mortality data, the way we look at these numbers, I don't think we look at them in the best way. So for instance, looking at percentages is not really a great thing. Like
yeah,
an ideal way, or rather one better way, I won't say ideal, but like one better way to look at it would be some of these numbers needs to be like need to be kind of like normalized with regards to their population, right?
yeah,
So
yeah.
for instance, had they looked at uh number of like suicide deaths in males per
Mm.
100 males,
Yeah,
right?
like a
Number of suicide deaths,
proportion rather than a
right, in
percentage.
females per 100 females, and number of suicide deaths in like per like 100 transgender persons,
Mm.
they could have clearly seen कि this is a very vulnerable group, because
Yeah.
in India we still see. So that's why I started with saying कि we do not have the basic census. So that's why we don't know the denominator here in case of India.
Mm.
But in places where we know that, right, in some of
Mm.
the high income countries which have collected this kind of data, it's actually very clear that people from transgender community are at times 4 to 5 times higher odds of self-harm behavior and suicide mortality compared to other people in the
Mm.
society. So I think it's very important, and actually like national level documents, suicide prevention strategy documents, something as big as this, it's very important to uh, not just kind of like put in all the numbers that we can, but actually critically see
Yeah, comment
what do
on
these
those numbers.
numbers mean and figuring
Yeah,
out good ways of representing them.
yeah, yeah. No, I totally agree. And they have also mentioned method of suicide, which is 80% are still because of hanging and poisoning. And before we go into the strategies, this I feel is again important because a lot of strategies should depend on the method of suicide. Like besides approaching it from the other end, which will be like the mental health part, but again they have sort of approached it from the methods as well in the strategy part. uh, Data is still missing for around 5 to 10%, which again is an issue, I feel. Moving on to the strategies part, when I was going through the strategies, I felt the entire approach was a very focused approach related to only mental health. Like you said, till now suicide was seen as an injury, and now I think it's seen mainly as a mental health issue. But we have gone through the it partly, definitely mental health definitely plays a role, but there are other factors as well which lead to the mental health issue. It's not just sort of a biophysiological psyche issue which is causing the suicide ideation or attempts. For example, the farmer protest that happened recently, that clearly was a more of a socio-economic thing causing the suicides, or the COVID pandemic, which was more of the workload, the stress causing the suicides in doctors. But this approach is still all about mental health, mental health. So, like, what do you think about that?
Yeah. So yeah, I mean, I guess, well, first of all, I should be honest, and I have like a clear bias here. Like I said, like I am a mental health researcher.
Yeah.
So yeah, I mean, like the way strategy is designed and it's like so focused on mental health, that definitely makes me happy. I think it also probably talks a little bit to the idea of who gets to sit on the table. And then this is probably the first time that a lot of people who have been involved with mental health work and issues uh, got to sit at the table where this strategy was designed, right? So I think it like the way, like you said, the way it's designed, it definitely also speaks to who were the stakeholders who were involved mainly in this,
Hmm.
right? One thing to recognize, uh, well, I guess I'm speaking to that a little bit. Uh, I think what has happened is that movement towards suicide prevention in the last couple years in India has been, although there are a lot of different players involved, it has been driven in large parts by people who are involved in mental health. So for instance, uh, even like even like at the beginning of this discussion, the way we started talking about it, it was that 2014 National Mental Health Policy, 2017 Mental Health Care Act, and
Yeah.
now 2022 like National Suicide Prevention Strategy, right?
Mm.
So I think even our policy discourse has been very mental health driven when it comes to
Yeah.
suicide. So
Yeah.
like there is like a clear imprint of that in case of this strategy as well.
Mm.
That said, I think it still does a good job of bringing on stakeholders from different places.
Mm.
Uh, One thing to remember, although, is that this is still a strategy that is being published by the Ministry of Health and Family Welfare,
Mm.
right? So the focus is going to be based on health, right? So this is not something that, let's say, is being sponsored by our law ministry, right?
Mm.
Or any other like rural development or like social empowerment or anything, any of those, right?
Yeah.
So I think the reason it's mental health focused is because the way health people look at it is also through like now mental health, right?
Mm.
So I think
Mm.
there is that. Uh, but I agree with you. Ki when it comes to suicide, there are some determinants that may seem distal, right, for researchers and for policymakers, but that feel very immediate to people going through that problem,
Mm.
right? So, as researchers or as like whatever, like analysts, decision makers, stakeholders, blah blah blah, uh, we we get very wrapped up in terms of let me think about suicide as a problem and what all factors affect it, and then let me do some really good like epidemiology and statistics and math and blah blah blah, right? And then I can show ki depression has this much risk of like
Yeah.
turning into suicide in this much time, and then substance use has this much risk, blah blah blah, right? So I think in all of that, what happens is that we, we often leave away factors which actually impact people's lives day to day. So for
Mm.
instance, uh, it's only very recently that, and which actually is very obvious still, it's only very recently that we now have very clearly established evidence based link for poverty and suicide. If you think about it,
Yeah,
there
it's very
has to be a
obvious.
very obvious connection.
Yeah.
But the
Yeah.
point is, since that's not how people studying the problem, that's not an issue that people studying the problem will study, right?
Yeah. Yeah.
Like suicide is something that mental health researcher will study. Mental
Mm.
health researcher may not be interested in poverty as a problem,
Yeah. Yeah.
right? So these kind of like synthetic demarcations that we have created in the yeah in like the academic and like policy making world,
Mm.
I think like I would like yeah, like people might have different views, but I would blame those like traditions and those divisions for the problem that you're mentioning.
Yeah, definitely, because
Right, there has to be a more holistic view,
holistic approach to this whole thing.
right?
And
Number
yeah,
one, and also there has to be a more uh yeah, I mean, for lack of better word, I would say there has to be a more like grounded and common sense approach to a lot of this,
yeah. The common
right?
sense is what is sort of sidelined when we are doing research because we are just so much into data.
Yeah,
This strategy also talks about like banning certain pesticides and producing safer pesticides. And I was going through the strategy and I saw this word farmer and I was really happy to see that, maybe they're uplifting the farmers or something, but the strategy read farmers will be taught about newer pesticides. And so that's again, the approach is again, that from the other end, that farmers will be given safer pesticides so they don't use those pesticides to commit suicide. But again, it's not like they don't have any other option. They'll be like, oh shit, pesticide aaj nahi hai,
yeah,
let's not do it.
yeah.
So
No,
again, what do you think about the strategies in general? Like,
yeah. Uh, yeah. So maybe, yeah. So like, I guess like talking about this specific example, and I think this is a really important example. So I think again, like there is like a background going on here. So National Mental Health Care Act, like when it decriminalizes suicide, but it also has like a whole lot of other things. And one of those things is key states should now create laws that restrict access to materials which have been commonly used for suicide, right?
Yeah.
WHO, by the way, supports pesticide ban as a way of suicide prevention. Uh, there is a lot, I mean, there is very obviously a lot of data showing like these methods work, right? So, I think from like clearly again like evidence perspective, it makes total sense. Uh, this strategy is basing a lot of that on, like I said, it's basing a lot of that on like the WHO documents, like the global suicide prevention, like calls for action, the National Mental Health Care Act of 2017, right? I think one good thing that this strategy is doing is that it's not solely focused on that approach. So if you look at National Mental Health Care Act, a lot of focus and a lot of time in that act is being spent on just this problem, which is like method of suicide and how can we figure out ways to mitigate or circumvent like the methods of suicide wala problem, right? So this strategy gladly is not doing that.
Yeah.
It includes it includes that, but it goes like way beyond that, right?
Yeah.
So
Yeah.
I think even like the specific like the pesticide thing that you're mentioning, that probably comes under like one out of like the four main goals, right? So
Yeah.
which is fine. I think in general, this approach of dealing with suicide key, if we get rid of the methods to commit suicide, we can get rid of the problem. That is a very problematic approach. So although we have evidence key banning pesticides reduces suicide like mortality rates, I think we need to be very careful in terms of interpreting that evidence, right? Number one, a lot of that evidence is based on just like short-term effects, right? It's not based on long-term effects. So like, I mean, if you look at 2 months after, like 2 months before and after such a law, clearly there is going to be some mortality reduction. But how sustainable is that, right? And then focusing on methods actually again takes away the focus from the actual causes, which may be like proximal or distal, right? And I think the focus has to be on socioeconomic, uh, socioeconomic factors. Focus has to be on general healthcare access. Focus has to be on mental healthcare access, right? Focus has to be on a lot of like substance use, alcohol use, tobacco use policies. So I think what happens is, when we focus on methods, uh, we almost kind of like tie the problem to the methods, as if we remove these methods, the problem is going to go away, right? But like you said, that's not the thing. I mean, if I don't get pesticide, but if I'm still going through like a phase of like suicidal ideation, and if I still have like self-harm behavior issues, I will figure out another way, right? So banning like the pesticide will probably, I mean, it will take me longer to figure out another ways, right? But so I don't think that's a good way of dealing with it. I'm just kind of partially glad that the strategy is not focusing too much on that. A lot of discussion on suicide prevention, again, in case of India, till now has focused on that, right? Even for instance, like the very recent example that rightfully got laughed at was IISc kind of like removing the ceiling fans and some other college putting like a cage, like a grill cage on the ceiling fan, right? uh so in that specific example, it's actually so obvious the reason people like, and when we say people, we are talking about young, extremely brilliant kids in our country, right? Like anyone who's making it to ISC or IIT or like whatever institute is definitely very motivated with regards to their like commitment to their future growth, blah blah blah, right? And they are very smart. So it's so the problem there then is not the ceiling fan. The problem is you have a high pressure and probably toxic environment that is pushing young kids to think of suicide, right? So I think the way we look at suicide has to change. we see a little bit of that in this prevention strategy, honestly. So we definitely see a shift towards focusing on the link between substance use and suicide, which was, again, like, as someone who has worked on alcohol use for like a couple years now, uh, it was actually great to see. He like, the strategy talks about creating awareness about how alcohol use is linked to self-harm behaviors, and that as a prevention strategy uh, for suicide prevention, right?
Yeah.
So I think similarly, uh, the place where it probably falls short is that I think you're right, Kate still focuses a lot on individualistic issues. And even when it goes out into some of the community support mechanisms and issues, even those are very much driven from the health, like public health and like mental health perspective,
Yeah.
and not so much from the socio-economic perspective and landscape of this problem. Yeah, I mean, yeah, being from Maharashtra, I know that like the number one cause of farmer suicides in Maharashtra consistently for last 20 to 25 years has been droughts. Now, drought is a natural thing which you probably can predict, but you definitely can manage, right?
Yeah.
And you definitely can support people whose problems have exacerbated due to that problem, right? So there have been consistent lack of efforts to do that,
Yeah.
right? So in case of like with regards to solving, let's say, like the problem of farmer suicides in case of Maharashtra, there is absolute, I find it very hard to believe that there is a mental health solution there.
Yeah.
There is a much easier socio-economic reform solution there, right?
Yeah.
So I think this strategy probably falls a little bit short on that. But like I said, a problem with that is if this is being driven by the health ministry, it's it's actually difficult for them to say as to who else wants to be involved in this or not.
No, I think Ministry of Social Welfare, maybe they could step in. Even Ministry of Women Empowerment, like even they, because women's suicides is, again, even though men have committed more suicide according to the report, still you have noticed like family reasons are one of the main reasons for suicides in women.
Yeah.
So I feel they have actually mentioned multi-sectoral approach, but again, the final strategies don't really look like that. They again, but yeah, like you said, at least something. But the thing is, we drop our expectations so much that if something comes out, we actually appreciate it. But looking at the entire strategy and their aims and objectives, how likely do you think is that we'll be able to get there by 2030?
Right. So I think maybe this is like a good time to talk, I guess, like a little bit about what's going on, right? So like the strategy itself has like very clear, I would say, like goals and objectives. They are following like the REDS approach, right? Reinforce, enhance, develop, strengthen, which is related to the live life approach formulated by WHO for suicide prevention, right? So there is that. Then a very good thing is that they clearly lay out the priority areas. One of the things that I although saw is key in like the priority area of like reinforcing leadership and like partnership and like institutional capacity. They talk about like reducing easy access to suicide modes. To me, that doesn't feel like a priority area that should come under like the R of the REDs, right? So I think there is some small misplacement there, but then but like that said, they have like a clear list of like priority areas that India should focus on. They have a really good and like detailed action framework, so like I said, key, like what does the strategy do? Under strategy, what are going to be like the specific action items? How will you measure the impact of action items? Like what indicators are we going to look at, right? Then which stakeholders are going to be involved for which specific action items, and what's going to be like the timeline of these action items, right? And then within that timeline, they have like the immediate, intermediate, and long term, right? So I think that framework as such is very strong and very detailed, and quite comprehensive. So it covers like a lot of things from uh, from like community action, like what community initiatives we need, what health system scale up do we need to actually achieve this, right? So yeah, what kind of like substance use and like alcohol use policies and changes do we need? So it uh, to actually going even ahead and talking about what's the role of mass media in case of suicide
Suicide
prevention, what's
reporting,
yeah, what's their responsibility, and what could actually be their very positive contribution when it comes to suicide prevention, right? So I think that is done very well. In addition to that, and this, by the way, framework is not unique to India. So let's be clear on that. So this is a like this kind of comprehensive framework is being followed by almost every country that's now designing its suicide prevention strategy, right? So, but I think India, yeah, like this particular, like in case of India, like this national strategy does an excellent job of putting it all together, right? An additional thing that they did that a lot of places have not done before, and that's also because the way we do things change, right? Like the fashion changes. So there is a new important and hopefully useful fashion of implementation science. And so report actually has dedicated enough space to, okay, these are our targets, right? These are the action items, and this is like the timeline. But how do we actually achieve that? So there is an entire menu of implementation options. If you want to achieve the scale up of like increasing mental health professionals, how can you do that? One way to do that is to increase the number of PG seats for psychiatrists, clinical psychologists, and like others, right? Another way to do that is to actually train some of the existing non-specialist professionals. So, for instance, let's say even like MBBS doctors in very specific mental health courses which are related to suicide prevention, right? So, I think providing those implementation options is what gives me a little hope that we might be able to.
And actually, that same table even talks about the ministries they can involve for those actions.
Right.
So yeah,
so I think there is like a clear outlay of stakeholders. If I could design it, going beyond stakeholders, I would have said who is responsible, right? But I think with regards to the larger like policy scheme and environment, that's not the approach that we take. But I think like when we are talking about stakeholders, these are probably the people who are going to lead some of these actions, right? So I think all of that is done really well. One thing that the strategy does not talk about, and which is actually not expected to be included in the strategy, but I hope there is some sort of a next policy or budgetary change or something coming up. But one thing that even when we talk about very detailed implementation options, that we are not talking about is where is the money for this going to come from, right? A lot of the options which are suggested under like implementation strategies are somewhat expensive options. So they're effective, they're evidence based, right? They're ethical, but they're expensive. So unless we are ready to pour money into this problem, all of this is going to be on paper.
Actually, I was coming to that point. We already have a lot of national programs which, in a way or the other, look at suicide. For example, we have.
If I could just interject, actually, since you said that, I think this strategy also does a very good job of giving an overview of what all is being done across programs, across ministries, across disciplines, right? So it goes on to even mention some of the national programs that are run under rural development ministry, right? So I think it does a really good job of that and kind of like pulling in all the players, right? That said, I think there is also a small risk here. If, for instance, it relies on, let's say, the district mental health program. Okay? So district mental health program has been one of the longest running programs for mental health, not just in India, but even globally. Okay. People have appreciated it for the way it's decentralized, right? Although one important issue is no one really knows what happens in that program. The data on its implementation and its like actual effectiveness has been really scarce. So Although this program is probably mentioned in literally every single mental health document related to India
Yeah,
that I
nobody
have
knows
ever
also.
read,
Yeah.
there is not a single national level comprehensive report which can tell you what actually happens in this program.
Yeah.
So now the problem is when your implementation strategies say we will lean on such a program,
Hmm.
I think that, like while building on existing infrastructure is definitely something that we should do. Okay?
Hmm.
India has had somewhat complicated history of not utilizing that enough. Okay? With every new government, with every new change in like policy and like politics and everything, we we directly start something new
New. Yeah.
without actually improving or building on the existing thing that's going on,
Hmm.
right? And which for a country like ours is very resource intensive and kind of turns out to be useless at the end, right? So
Yeah.
I think the strategy does a good job of not repeating that mistake,
Hmm.
but then we should also be cautious ki how much do we want to rely on the existing infrastructure which
Hmm.
does not have good reputation or which does
Any
not have
report
good
is.
evidence base.
Yeah, no evidence. So that's exactly what my question was. It summarizes really well what other programs are doing. For example, there is National Mental Health Program, there is National Palliative Care Program,
Mhm.
Nasha Mukti Abhiyan. So it summarizes everything really well. Every program which I mentioned, even Ayushman Bharat, has some role of suicide prevention. So do we really need a national suicide prevention program? The strategy is out. Do we really need a program with, like you said, funds are needed? So should we expect a program in the coming future with separate funding? Because I'm sure you are working with a lot of groups who are working on suicide prevention in India. So is there any inside information on this? Anything you would like to share with us?
Uh, well, at least I am not entirely aware of if there is like going to be a vertical specific program focusing on suicide prevention or not.
Hmm.
Uh, I- I'm not aware about it. Uh, I think I think it took a lot of effort to bring this strategy in the first place.
Hmm.
So, for instance, uh, I know of some of the people who were involved in like the technical discussions that led to this strategy. And yeah, I think it took like a massive effort to bring this document into existence in the first place.
Hmm.
So, uh, my best guess is going to be even launching like a national program is going to be very tricky.
Hmm.
Uh, that said, if we ever reach that point, I would support such a program because that's how you get the money,
Hmm.
right?
Yeah.
I think a problem with national programs is that uh, there is a lot of focus on then there is like a lot of focus on specific program targets. And
Hmm.
so if those program targets are not really aligned with the final targets, uh, you are in this weird space where you have achieved enough for you to say that the program is good, but
Hmm.
not achieved enough to say that the problem is over,
So yeah.
right?
Yeah.
So, uh, yeah, I think maybe what's best right now is if we can figure out mechanisms to get at least let's say like 50% of what's mentioned in this document funded,
Hmm.
that would be really amazing.
Yeah.
So like
Hmm.
I guess if I were to choose between putting all the money in a vertical program,
Hmm.
okay, and putting distributed money into like a package of strategies mentioned, like package of implementation strategies,
Hmm.
implementation options
Hmm.
mentioned in like the national prevention strategy. Yeah, I would go with the latter.
Yeah.
Put in money into these very specific things
Hmm.
that have very specific indicators that you can measure
Hmm.
and that we know are tied to the final indicator, which is reducing suicide mortality.
Hmm.
That said, one thing I do want to mention, which is not related, like which is not in the strategy document per se, which I
Hmm.
believe should have been there.
Hmm.
Okay? Ki, uh, there is some new literature on some of the forecast modeling for suicide mortality in case of India, right? So there is a recent paper by and it's a really good paper which tries to forecast based on like the trends from NCRB data of last 35 years, what the suicide mortality rate might look like for the decade of 2020 to 2030, right? So based on our past trend, and the reason I'm mentioning this is to answer the question ki, do we need a strategy or do we need a program, right? If there were so many things happening, why do we even need a document like this just to tell us ki, like together we can do this, right? So the utility of that document is ki, based on the trend of past 35 years, what we know is ki, the decadal change for the next decade in case of suicide mortality would have been 1%. So the reduction in 2030 at current rate will be just 1%, right?
Yeah.
So the reason ki this document has importance is ki hopefully it can bring in change, ki we can go away from that 1% reduction to the targeted 10% reduction, right? Because at our current rate, we have research showing that 10% is not achievable the way we have been doing things. So we need to change something, right?
Yeah. So we have sort of gone through the entire report, and to sort of summarize, the report is good. It's a good first step to something better, but it still needs a lot of improvement. Better data could be one. More socioeconomic approach to suicide rather than just focusing on mental health could be one. Focusing on the reasons for suicide causes rather than the approach should have been done. Any final take-home message from you to all the policymakers if anybody ends up watching this video?
Yeah.
Any message that you want to convey?
Yeah. Well, first thing I definitely want to say, yeah, this is a really good and progressive suicide prevention strategy. Okay. So and this is something I have, I guess, like seen with like Indian policy documents a lot of times. Like when it comes to designing policies, we have some really good people putting in a lot of thought and work, you know. So I think that definitely needs to be appreciated. That said, like the cynic in me tells me that none of this is going to matter if we do not put our money where our mouth is. So now we have committed to the world, right? We have committed to our citizens that this is what should be done, this is what we will do. So I think like next 8 years, with regards to suicide prevention, all focus, including like suicide surveillance, for example, is an important theme in this strategy, right?
Yeah.
We need to collect better data. We need to collect data on suicide attempts, right? A lot of that data can be collected actually not through expensive interventions, but just by community reporting, which is shown to be reliable in other countries, right? So, yeah, like the small point aside, but next 8 years need to focus on targeting on these specific things, right? Funding these specific things and getting important players who are working for these, getting them the money, getting them the resources, and letting them do their thing.
Yeah, so money is the problem. We have
Money is definitely. So I think, I mean, I would say at the very crux, money is the problem. But what money does is it brings in resources, right? It brings in people, it brings in smart people, it brings in motivated people, it brings in capital resources, infrastructural resources, right? All of that. So I think, yeah, one way or another, we need to figure out how can we put together a team of people who probably maybe don't even know each other and don't even know they are working towards the same thing, right? But how do we, yeah, as a country, put together that team to work on this problem?
And we definitely have enough people to, be a part of that team. We have enough brilliant people to be a part of that team.
I think that's not the problem. So that's why I focused on money, right?
Yeah.
I don't think we don't have enough people. I don't think we don't have smart people. We have enough people. We have very smart people. We have very motivated people who want to work on this.
Yeah.
So now we just need to make sure they get all the resources that they require to actually achieve this in in their own domains and their own areas, right?
Yeah. So let's hope the budget is going to come out soon.
Yeah.
And let's hope there is some good news.
I am really hoping there is an increase in budget for health, there is an increase in budget for mental health, and there is at least one mention saying कि we release suicide prevention strategy this year, and that forms an important part of the health budget.
Yeah.
I hope that happens.
Yeah, we can hope. All we can do is hope. So thanks a lot, Siddhesh. This was a great session.
Of course.
And we have sort of gone in depth and touched some topics in depth and some superficially, but I'm sure, like this will be a good start to this discussion around suicide and suicide prevention in India. So thanks a lot once again for joining, taking out time for this. And I hope I can get you back on this platform soon.
Definitely. Thanks for having me. And maybe just one last thing. I would urge everyone who's listening to this, it's a very short document, but please try and read the document for yourself. It's really important people read these documents, people try and understand these documents, critique these documents, and maybe even provide active feedback to decision makers about these documents, right?
Yeah.
So I hope everyone listening to this doesn't just pause at listening to this, but this hopefully motivates people to read the document itself.
And actually, Asar has its own report on suicide, which also I'll share in the video description, which also you can refer to and compare our report with. So I work with Asar, which I didn't mention. So we can compare the report with the suicide prevention report and see, how we represented data in that report versus how it was represented.
Yeah, it would be great if you could link both those things in the description.
Yeah, definitely. I'll add the links in the description to all the resources, all the papers that we discussed.
That would be amazing.
So all of that will be available in the description below. So thanks a lot, Siddhesh, again. And I hope to see you soon.
Yeah. Thanks for having me. Bye-bye.